Many people wonder what makes us different here at Physical Therapy for Everybody, and I believe that it starts with the evaluation. How we do our evaluation is different than a typical physical therapy evaluation. So that's what we're going to discuss today, so you know what to expect when you come in for your evaluation. Now, the most important part of the evaluation is that we want to see you move. So we will have you walk to start with, to understand how your entire body is working together. So everything in your body is connected, and if you're suffering with low back pain but your ankle's not moving right, we're gonna need to work on that ankle to get improved mobility so that your low back pain goes away. So we wanna see how your body is just moving in space. Then we'll look at how specific joints are moving that are more directly related to your problem. Now, we may ask you to move joints that aren't related to your problem, but again, everything's connected. So we ask you to bear with us because we're looking to rule things in and rule things out. We want to figure out what the tissue is in lesion. So that's the pain generator. What is the tissue that's causing the pain? And then we want to figure out why is that tissue causing pain. So is there an area that's moving too much? Is there an area that's not moving enough? Is it muscle, joint? Again, all of these tests that we're going to do are going to help us figure out the root cause, the pain generator, but then also why that particular tissue is causing that much pain. Now, along the way, we are also going to test your strength. We want to see how the muscles around that area are working, if there's any instability issues within that joint, how everybody's coordinating together. We may need to do some specific muscle testing. We may need to do some more general, broad-based muscle testing. It really depends on what's going on with you, but we will test your strength to see if that's causing part of the issue that you're dealing with. Now, the next thing we might do is test your nerves. So if you're having numbness or tingling or anything like that going in your body, chances are good that we'll do some very basic nerve testing just to see how those nerves are functioning at this point. Now, there's no need to be concerned. None of this will be painful. It'll be a pretty simple stuff. It's not like the more advanced, sophisticated nerve conduction testing or something like that you may have heard of. It's more like what you're used to seeing at the doctor's office, where they'll test your sensation, maybe put a cotton ball on your skin or test your reflexes or something like that. So it's not painful or anything like that, and we may not do it if you're not having any nerve symptoms. Now, the next thing we're going to do is some special tests. So these are pretty standardized throughout the physical therapy profession, but they help us figure out, again, what that particular tissue is in lesion. So there's lots of special tests for different areas in the body. We'll apply the ones that are most applicable for you. Now, I will say that we do tend to do a broader base than most people. So if you're having, let's say, knee pain, we will do special tests for the knee, but we will also do them for the hip, the SI joint, and the low back, because we want to see how everything is all related. In addition, obviously in that case, we would look at how the ankle is moving and may do some muscle tests on the ankle. So we will do special tests for the specific area that is causing your pain, because we want to understand more about that, but we may even go in a more broad base to understand how this is affecting your whole body system. Now, the last two parts of the evaluation are where we really get into the difference here at Physical Therapy for Everybody. The first one is we're going to assess your joint mobility. So we want to understand if the joints are moving correctly. They can be moving incorrectly by being hypomobile, which is not moving enough, or hypermobile, which is moving too much. Now, here's the thing. Most commonly in our bodies, if you have an area that's moving too much, you also have an area that's not moving enough. So your body's always trying to find balance, and that can be a very big challenge for you. So we need to figure out what's going on and how your body is compensating. It is really important to understand how the joints are moving. The next one we're going to do is understand how the soft tissues are moving, most commonly the muscles. So we do that by putting our hands on you and assessing the muscle tone. And we may check everything from your diaphragm, which is underneath your rib cage. We may check down your back, your glutes, It just depends on what's going on with you, but we're going to check all the applicable muscles. Now, some of them may not be a problem, which is great. Then we just know that for moving forward. But we're going to check everything that could potentially be connected to that chain, because we want to understand, again, from the beginning, what is going on with you, what has your body created in these compensation patterns, and who is going to need some help along the way. Now, I will say that I've had some patients come in and we've seen some things that I wasn't sure were directly related, and we have that conversation of saying, hey, I'm seeing this, I'm not sure that it's directly related. Are we okay to just move forward with this part, the part that's bothering you, the part that you're complaining about, but kind of put this one on the back burner and come back to it later on? It may be that your body's able to heal that other part on its own once we've dealt with the primary issue, but it may be that your body says, actually, I'm going to need some help with that area too. Again, that's all the discussion that we'll have during the evaluation, and you get the opportunity to give your 2 cents as well. I've had some patients who have said, nope, I want to deal with all of it at once. I don't want to have any problems after this, which is absolutely fine. I've had some patients who are like, yeah, let's put that on the back burner and see what happens in the future and deal with this primary issue first, which again is absolutely fine. You get to decide how we move forward. I'll present you with the information of what your body's telling me, and then you can decide how you want to proceed in the next situation. So that's it. At the end of the evaluation, we'll be able to tell you, 1, your tissue and lesion, so your core problem, 2, the compensation patterns that your body has developed that are getting you to this point or keeping you stuck in this point, and 3, we'll outline the plan. At the discovery visit, we already set your goals. The evaluation has now told us where your body is. So we know where we are. That's our starting point. We know where we're headed because we already set those goals, and I'll be able to explain to you the path to get you from the beginning to the end. Now, what questions do you have about the evaluation here at Physical Therapy for Everybody? Drop a comment below. We'd be happy to answer your questions. And if you haven't heard of the discovery visit before, then I encourage you to check out this video here. Have a great day, everyone.